How does healthcare inclusion impact patient outcomes? Have you ever wondered how the way healthcare is delivered can change the experience for patients? The concept of healthcare inclusion plays a significant role in shaping patient outcomes. When healthcare services reflected the diversity of the communities they serve, everyone benefits. Healthcare inclusion means providing care that respects and understands the various backgrounds of patients. This includes considering factors like race, ethnicity, disability, and language. When healthcare providers mirror the characteristics of their patient population, patients are more likely to seek care and stick to their treatment plans. For instance, studies show that patients of color often feel more satisfied and trust their healthcare providers when they share similar backgrounds. This trust leads to better preventive care and adherence to treatments. Communication is another key area where inclusion makes a difference. When healthcare providers are trained to respect cultural and linguistic differences, misunderstandings decrease. This means patients are more engaged in their care, and providers can tailor treatments to meet individual needs. Improved communication can lead to safer and more effective healthcare experiences. The benefits of inclusion extend to measurable health outcomes as well. Research indicates that when care teams are diverse, health outcomes improve. For example, infant mortality rates and chronic disease management show better results when patients receive care from providers who understand their social and cultural contexts. This is especially important for marginalized groups, including people with disabilities. Trust and satisfaction are also enhanced through inclusive practices. When patients feel respected and understood, they are more likely to trust the healthcare system. This trust encourages them to participate in preventive measures and follow-up care, which ultimately leads to better health. Healthcare inclusion also plays a vital role in reducing health disparities. By addressing systemic barriers that prevent certain groups from accessing quality care, inclusive practices can improve healthcare for people with disabilities. This includes ensuring that facilities are accessible and that providers receive training on the specific needs of disabled patients. Moreover, inclusion in clinical research is essential. When diverse populations are represented in clinical trials, it leads to more comprehensive data and treatments that work for everyone. This is crucial for developing therapies that meet the needs of underrepresented groups, including those with disabilities. Healthcare teams also benefit from diversity. Inclusive teams often experience improved problem-solving and innovation, which translates into better patient care. To implement these inclusive practices, healthcare professionals can undergo training in disability competence and cultural humility. Creating accessible healthcare environments is also important. This includes providing communication tools for patients with sensory or cognitive disabilities. Additionally, recruiting healthcare providers with disabilities can enhance empathy and understanding within the system. In summary, healthcare inclusion leads to more effective and patient-centered care. It improves outcomes by building trust, enhancing communication, and increasing access. This is especially important for people with disabilities and other marginalized groups seeking inclusive medical services.